We close our eyes at night, trusting that we will wake up refreshed. We view sleep as a sanctuary. But for a specific group of seniors, sleep can become a period of profound danger.
There is a terrifying phenomenon known in neurology as the wake-up stroke.
During the night, a blood vessel deep inside the brain ruptures. They do not feel the initial pop.
Blood slowly leaks into the delicate tissue, killing neurons by the millions.
When they wake up, the window for treatment has often passed.
But here is the truth. A brain bleed rarely happens without a whisper before the scream.
In this video, we will reveal the 5 signs that your brain is bleeding as you sleep.
And we will provide the nighttime protection protocol to lower intracranial pressure.
Before we dive in, hit that button.
Part 1. The physics of the night bleed.
Your brain is encased in a hard bone box. There is no room for expansion.
During the day, gravity helps drain blood from your brain down towards your heart.
But when you lie down flat, the blood volume in your head increases.
For a senior with cerebral amyloid angiopathy, proteins build up, making arteries brittle.
When you lie flat, these brittle vessels are subjected to higher internal pressure.
It might be a microbleed, a silent assassin causing inflammation and cognitive decline.
Part 2. The sentinel headache.
Sign 1. The headache that wakes you up.
A headache caused by a brain bleed has a very specific signature. It wakes you up.
The meninges are incredibly sensitive to pain.
When a blood vessel leaks, blood irritates the meninges. It acts like a chemical burn.
Doctors call this a hypnic headache or a sentinel headache.
It might be a sharp, stabbing pain behind one eye or at the back of the skull.
Many seniors make the fatal mistake of taking a painkiller and trying to go back to sleep.
It is your body screaming that the pressure inside your head is too high.
Do not go back to sleep. Sit up. Being upright helps lower intracranial pressure.
Call for help immediately.
Part 3. The morning nausea.
Sign 2. Vomiting. Without a fever. We expect it to come with a fever. But if you wake up without any other stomach symptoms, this happens because of the area postrema, the vomiting center.
The pressure inside the skull pushes against the brainstem, triggering the vomit reflex.
It is often projectile, and it comes on suddenly upon waking.
Often accompanied by a stiff neck. Do not assume it is the flu.
Part 4. The dead limb. Sign 3. One-sided numbness that does not wake up.
We have all had the experience of sleeping on an arm wrong. It feels heavy and tingly.
This is called neuropraxia. It is a temporary compression. Feeling comes back.
But a stroke numbness feels different. First, it does not get better with shaking.
If there is absolutely no change, that is not a pinched nerve. That is a brain failure.
Second, it respects the midline. A stroke usually affects the entire side, the arm, the leg, and often the face. Third, it is often a negative sensation. It is a void of sensation.
The brain has lost connection with the limb. Test it immediately. Lift both arms. Smile. If one side lags, it is a stroke.
Part 5. The vision shift.
Sign 4. Seeing double or partial blindness. Your eyes are windows to the occipital lobe, which processes vision.
You might wake up and see 2 alarm clocks instead of 1. Double vision is a classic sign.
Or a visual field cut. The right side is just missing. It is a void.
This is called hemianopsia.
Many seniors assume they just have sleep in their eyes. They rub their eyes and blink.
But if the vision loss is specific, it is not an eye problem. It is a brain problem.
Cover one eye. If double vision disappears, it means the brain cannot align the images.
Part 6. The confusion of time.
Sign 5. Waking up in a fog.
We all experience sleep inertia, but we usually know where we are.
A brain bleed causes profound disorientation. You might not know what year it is.
I can't seem to.
Try to speak and realize the words are not there. This is called aphasia.
The person looks awake, but their lights are not on.
This is different from dementia. This is acute, sudden changes.
There is a myth that you should let a confused person sleep it off.
Sleep is dangerous.
We cannot talk about nighttime stroke without talking about the trigger.
Part 7. The hidden trigger, sleep apnea.
When you stop breathing at night, your oxygen levels drop. This causes your brain to panic and release adrenaline.
This adrenaline causes a massive spike in blood pressure, up to 200. This pressure hammer slams against the brittle walls of the cerebral arteries.
It is not a coincidence that most wake-up strokes happen in the early morning hours.
If you snore loud enough, or wake up gasping.
The idea of a silent stroke is terrifying, but you can control the physics of your skull. Part 8.
Part 8. The prevention protocol.
Protocol 1. The angle of repose.
Do not sleep completely flat. Sleeping flat maximizes intracranial pressure.
Elevate the head of your bed by about 30 degrees.
You can use a wedge pillow or adjustable bed frame.
This slight elevation uses gravity to help drain the venous blood, lowering pressure.
Protocol 2. The hydration balance.
Dehydration thickens the blood, increasing the risk of clots. But overhydration right before bed raises blood pressure due to a full bladder. Drink the majority early. Stop fluids 2 hours before bed.
However, do not go to bed thirsty. A small sip is safe.
Protocol 3. The blood pressure timing.
We have discussed chronotherapy, taking meds at night.
If you are a non-dipper, meaning pressure stays high at night, you are at maximum risk.
Ask your doctor about 24-hour ambulatory blood pressure monitoring.
Taking your blood pressure medication at night might be the key to saving your brain.
Protocol 4. The alcohol ban. Alcohol acts as a blood thinner, which sounds good.
But it also increases blood pressure and relaxes the throat, worsening sleep apnea.
This combination is the perfect recipe for a leak.
Avoid alcohol, specifically within 4 hours of bedtime.
Protocol 5. The aspirin review.
For years, seniors took baby aspirin to prevent clots. But aspirin thins the blood, making a bleed more likely.
Current guidelines suggest daily aspirin might do more harm than good.
Review your aspirin use with your doctor.
Stopping it could strengthen your body's ability to seal a microbleed.
Conclusion. Waking up safe.
The thought of our own body betraying us is a heavy one. But knowledge lightens that load.
You are an observer. You are a guardian of your own health.
By changing the way you sleep, you are reinforcing the walls of your brain.
You are turning the night back into a sanctuary.
Sleep should be a time of peace, not peril.
Take these steps. Secure your health.
And rest easy, knowing you have done everything to protect the incredible machine that is your...
Now I would love to hear from you. Do you suffer from morning headaches?
Or have you ever woken up with a numb limb that scared you?
Share your experience in the comments below.
If you found this video helpful, please leave a comment with 1.
If not, type 0. I value your honest feedback.
And do not forget to like, share, and subscribe for more content.
Dedicated to protecting your brain, your heart, and your future.
Thank you for watching, and take care of yourself.